Eye floaters, those pesky specks in your vision. Have you ever noticed tiny specks, dots, or squiggly lines drifting across your vision, especially when looking at a bright sky, a plain wall, or a computer screen? These common visual phenomena are known as eye floaters. While they might seem like something on the surface of your eye, they're actually tiny shadows cast by microscopic bits of debris floating inside your eye. What exactly are floaters and how do they appear? To understand floaters, let's look inside your eye. Most of your eye's interior is filled with a clear, jelly-like substance called the vitreous humor. This vitreous helps maintain the eye's round shape and acts like a transparent window, allowing light to pass through to the retina, the light-sensitive tissue at the very back of your eye that sends visual information to your brain. Floaters appear when tiny clumps of cells, protein fibers, or other debris within this vitreous cast shadows on your retina. As these tiny bits drift within the fluid vitreous, their shadows move, creating the illusion of specks floating in front of your eye. You might notice them darting away when you try to look directly at them, a frustrating but perfectly normal characteristic of floaters. The most common reason, age-related changes. For many people, floaters are a natural and harmless part of the aging process. Typically appearing between the ages of 50 and 70, the vitreous humor naturally undergoes changes. It begins to liquefy and shrink, and as it does, some of its microscopic protein fibers and cells can clump together. These clumps are the most frequent culprits behind the shadows you see. Beyond aging, other important causes of floaters. While age-related changes are the most common reason for floaters, it is absolutely crucial to understand that floaters can also be caused by other factors, some of which are more serious and require immediate medical attention. These causes extend beyond the normal aging process and can sometimes signal an urgent eye condition. Here are some other important causes of floaters. Posterior vitreous detachment, PVD. This is a very common, age-related event where the entire vitreous gel naturally separates or pulls away from the back of the retina. A PVD often causes a sudden, noticeable increase in floaters, and can sometimes be accompanied by flashes of light. While PVD itself is usually harmless, an eye exam is essential to ensure that no damage occurred to the retina during the separation. Retinal tears or detachment. This is one of the most serious causes. If the shrinking or pulling vitreous tugs too hard on the retina, it can cause a tear. Fluid can then leak through this tear, causing the retina to pull away from the underlying tissue, a condition known as a retinal detachment. This is a medical emergency that requires immediate treatment to prevent permanent vision loss. The floaters here are a symptom of this urgent issue, and treatment will focus on repairing the retina itself, rather than addressing the floaters directly. Bleeding in the eye. Vitreous hemorrhage. Blood cells in the vitreous can appear as new floaters. This can happen due to conditions like diabetic retinopathy, eye damage from diabetes, high blood pressure, or as a result of an eye injury. The floaters here are blood cells. The crucial step is to identify and treat the underlying cause of the bleeding. Inflammation. Uveitis. Inflammation inside the eye, known as uveitis, can release inflammatory cells and debris into the vitreous, causing floaters. Treating the underlying inflammation is key to managing these floaters. Nearsightedness. Myopia. People who are highly nearsighted are often more prone to developing floaters, sometimes at an earlier age. This is due to differences in their eye structure, as nearsighted eyes are typically longer, leading to more stretching and changes in the vitreous. The approach to these floaters is generally similar to age-related floaters, focusing on observation unless they are severely debilitating and require intervention specifically for the floater itself, rather than a separate underlying eye disease. Eye surgery or injury. Floaters can sometimes appear after certain eye surgeries, like cataract surgery or retinal repairs, or following any trauma or injury to the eye. The treatment depends on the specific nature of the post-surgical floaters or injury, as the floaters are a direct consequence of the event or healing process itself. Floaters and glaucoma, understanding the connection. A common question is, are floaters a sign of glaucoma? It's important to clarify that floaters are generally not a direct or primary symptom of glaucoma. Glaucoma primarily involves damage to the optic nerve, the nerve connecting your eye to your brain, often due to elevated pressure inside the eye, which can lead to a gradual loss of side, peripheral, vision. While floaters are not a direct symptom, there can be some indirect connections. Coexistence of conditions. Both common age-related floaters and glaucoma become more prevalent as people get older. Therefore, it's entirely possible for an individual to experience floaters due to normal aging and also develop glaucoma independently. The presence of one does not automatically mean the presence of the other. Rare glaucoma types with bleeding. In very rare instances, specific types of glaucoma, such as neovascular glaucoma, a severe form that can arise from underlying conditions like advanced diabetes, may involve the growth of fragile new blood vessels. These vessels can leak blood into the vitreous, which would then appear as new floaters. In such cases, the floaters are a complication related to the severe underlying condition causing that specific type of glaucoma. The most crucial takeaway here is that symptoms like a sudden increase in floaters, new flashes of light, or a shadow in your vision are urgent signs that point to a potential retinal tear or detachment. This requires immediate medical attention, regardless of whether glaucoma is present. When to be concerned, the red flags you can't ignore. While many floaters are harmless, it's crucial to know when they might signal a more serious, vision-threatening problem. You should contact an eye doctor immediately if you experience any of the following red flag symptoms. A sudden onset of new floaters. This means a noticeable increase in the number you see, or what might look like a shower of black dots or cobwebs. New flashes of light in the same eye as the floaters. These flashes often look like lightning streaks or camera flashes, particularly in your side vision. A shadow or curtain appearing in your peripheral, side, vision or blocking part of your central vision. Any accompanying eye pain, redness, or sudden blurry vision. Why this is urgent. These symptoms could indicate a retinal tear or retinal detachment, which are medical emergencies. Prompt treatment is often necessary to prevent permanent vision loss. Your eye doctor will perform a thorough, dilated eye exam to check your retina. How often should you see your eye doctor for floaters? The urgency and frequency of eye doctor visits for floaters depend on your specific symptoms and the initial diagnosis. Immediate eye exam, urgent care if you experience any of the red flag symptoms mentioned above, sudden onset of new floaters, new flashes, a shadow or curtain in your vision, sudden blurry vision, or floaters with eye pain. Contact your eye doctor immediately, or go to an emergency room if your doctor is unavailable. This immediate visit is for urgent care to check for serious problems like retinal tears or detachments. Timely follow-up after a new, non-urgent onset, within days to a week. Even if new floaters appear without any of the urgent, red flag, symptoms, it's still advisable to see your eye doctor for a comprehensive dilated eye exam within a few days to a week. While many new floaters without flashes are benign, often due to an uncomplicated posterior vitreous detachment or PVD, an eye doctor needs to confirm this and rule out any subtle retinal issues that might not immediately present with flashes. A PVD itself can sometimes lead to a retinal tear days or weeks after the initial symptoms, especially if there's significant pulling on the retina. Routine follow-up after initial assessment. If floaters are stable once your eye doctor has examined your eyes and determined that your floaters are harmless, e.g., typical age-related floaters or an uncomplicated PVD with no retinal tears. Initial follow-up. If PVD occurred, your doctor might recommend a follow-up exam within 4 to 6 weeks after a new PVD, especially if you have risk factors like high nearsightedness, or if there was any minor bleeding at the time of PVD. This helps catch any delayed retinal tears. Regular annual comprehensive eye exams. For most people with stable, harmless floaters, regular annual comprehensive eye exams are usually sufficient. During these exams, your eye doctor will continue to monitor your floaters and overall eye health. This helps to track any changes in the floaters, detect new floaters or symptoms that might arise, check for other age-related eye conditions like glaucoma or cataracts, and ensure your retina remains healthy. Return sooner if changes occur. Crucially, even if your floaters have been deemed harmless, any new or sudden changes in your floaters or vision warrant an immediate call to your eye doctor, regardless of your last appointment. In summary, your vision is too precious to take chances. Never ignore new or sudden changes in floaters, especially if accompanied by flashes of light or vision changes. Always consult an eye care professional, optometrist or ophthalmologist, to get a proper diagnosis and guidance on your specific situation. Living with and treating floaters, tailoring approaches to the cause. The most important aspect of managing floaters is accurately diagnosing their underlying cause. While many floaters are harmless and require no direct intervention, serious causes demand specific and often urgent treatment. Here's how treatment approaches differ based on the cause. 1. For age-related floaters, common vitreous changes and uncomplicated PVD. Primary approach, observation and adaptation. For the vast majority of floaters caused by normal vitreous changes or a PVD without complications, the main treatment is simply observation. Your brain often learns to filter them out over time. The floaters themselves may also settle out of your central vision. When to consider intervention, if these benign floaters are exceptionally large, dense, and significantly interfere with daily activities, like reading, driving, or work, even after a period of adaptation, your eye doctor might discuss specific interventions. These are generally reserved for severe cases where floaters genuinely impair quality of life. Laser vitreolysis. This procedure uses a specialized laser to target and break up large, well-defined floaters into smaller, less disruptive pieces, or to vaporize them entirely. It can be effective for specific types of floaters, particularly those that are large, dense, and located safely away from the retina and natural lens. While less invasive than surgery, potential risks include a temporary increase in eye pressure and, rarely, damage to the retina or lens if not precisely aimed. Not all floaters are suitable candidates for this treatment. Vitrectomy, surgery. This is a surgical procedure where the vitreous humor, the gel-like substance containing the floaters, is carefully removed from the eye. It is then replaced with a clear saline solution or another fluid/gas. The floaters are effectively removed along with the vitreous. While highly effective at eliminating floaters, it is a more invasive surgery and carries higher risks, including cataract formation, especially common in older patients, retinal tear or detachment, a serious, vision-threatening complication, bleeding inside the eye, infection, macular pucker or edema, swelling near the center of the retina, and a small risk of permanent vision loss. Due to these potential risks, vitrectomy is typically reserved for severe cases where floaters seriously interfere with daily activities and less invasive options are not suitable or effective. For floaters caused by retinal tears or detachment. Urgent and direct treatment. This is a medical emergency where the floaters are a symptom of a much more serious underlying problem. The primary treatment is not for the floaters themselves, but to repair the retinal tear or detachment. Treatment modalities. Laser photocoagulation. For a retinal tear, a laser can be used to weld the retina to the underlying tissue around the tear, preventing it from detaching further. This creates a scar that seals the tear. Cryopexy, freezing. This uses a freezing probe applied to the outer surface of the eye directly over the tear. The freezing causes a scar that helps secure the retina to the eye wall. Pneumatic retinopexy, for certain types of detachments, a gas bubble is injected into the eye, and positioning helps the bubble push the retina back into place, often combined with laser or cryopexy to seal the tear. Scleral buccal surgery. A silicone band is sewn onto the outside of the eye to gently indent the eye wall, supporting the retina and relieving traction. This is often combined with laser or cryopexy. Vitrectomy. For retinal detachment. In cases of complex retinal detachment, a vitrectomy might be performed to remove the vitreous gel that is pulling on the retina, allowing the retina to be flattened and then reattached with laser or cryopexy. Air, gas, or silicone oil may be injected into the eye to help hold the retina in place while it heals. Goal. The immediate goal is to reattach the retina and preserve vision, which in turn resolves the associated floaters, often blood or pigmented cells from the tear. 3. For floaters caused by bleeding in the eye, vitreous hemorrhage. Treat the underlying cause. When floaters are due to blood in the vitreous, the focus is on identifying and treating the source of the bleeding. Common causes and treatments. Diabetic retinopathy. This might involve laser treatment, panretinal photocoagulation, to seal leaking blood vessels, or injections of anti-VEGF medications, antivascular endothelial growth factor, to reduce abnormal blood vessel growth and leakage. Retinal vein occlusion. Treatment can involve injections of anti-VEGF medications or steroids, and sometimes laser. Eye injury. Treatment depends on the severity of the injury and may range from observation to surgical intervention to stop the bleeding and repair any damage. Vitreous clearance. If the bleeding is severe and persistent, obscuring vision or preventing treatment of the underlying cause, a vitrectomy might be performed to remove the blood and clear the vitreous. For floaters caused by inflammation, uveitis. Targeting the inflammation. Floaters caused by uveitis are a result of inflammatory cells and debris. The primary treatment focuses on reducing the inflammation. Treatment modalities. This typically involves steroid eye drops, oral steroids, or steroid injections into or around the eye. In some cases, other immunosuppressant medications may be used if the uveitis is severe or chronic. If an infection is causing the uveitis, specific antiviral, antibacterial, or antifungal medications will be used. Goal. By controlling the inflammation, the release of inflammatory debris into the vitreous is reduced, which helps clear existing floaters and prevent new ones. A vitrectomy may be considered in rare, severe cases to remove inflammatory debris or for diagnostic purposes. For floaters related to myopia, nearsightedness. Similar to age-related, floaters in highly myopic individuals are often due to similar vitreous changes, but these changes can occur at a younger age due to the elongated shape of the eye. Myopic eyes also have a higher risk of retinal tears and detachments. Treatment. The approach is generally the same as for age-related floaters, observation for harmless floaters, with laser vitreolysis or vitrectomy considered only for significantly visually disabling opacities. The decision for surgery in highly myopic eyes is made with extra caution due to the slightly higher risk profile in these eyes during vitrectomy, e.g., increased risk of retinal tears/detachment during surgery due to a thinner, more fragile retina. For floaters after eye surgery or injury. Dependent on the specifics, the treatment depends entirely on the type of surgery or injury and the nature of the floaters. Air, gas, oil bubbles. After certain retinal surgeries, e.g., for retinal detachment, air, gas bubbles, or silicone oil are often injected to hold the retina in place. These can appear as large, distinct floaters but will naturally resolve, air/gas, or may require a subsequent surgery to remove, silicone oil. No specific treatment is needed for these floaters themselves, as they are part of the healing process or a necessary surgical component. Postoperative hemorrhage/inflammation. If floaters arise from bleeding or inflammation post-surgery, these specific complications would be treated as described above, e.g., with steroids for inflammation, or waiting for blood to clear/vitrectomy if severe and persistent. Increased visibility of pre-existing floaters. After cataract surgery, vision becomes much clearer, making previously unnoticeable floaters suddenly apparent. These are typically managed with observation. New PVD/retinal tear. Eye surgery can sometimes trigger a PVD or, less commonly, a retinal tear. These would be managed as described in sections 1 and 2. In essence, while the common, benign floaters are often managed with observation, any new, sudden, or visually significant floaters require a thorough eye examination to rule out and appropriately treat the potentially serious underlying causes. The floaters themselves are often just a warning sign, and treating the root problem is paramount to preserving vision. Medication and supplements for floaters. What to know. For the most common, age-related eye floaters, medication is generally not a primary or highly effective treatment option to directly dissolve them. There is no widely proven medication that can reliably eliminate these physical clumps of debris in the vitreous. While no standard drug exists to cure common floaters, here are some areas that have been explored. Enzymatic vitriolysis, pharmacologic vitriolysis. This involves injecting specific enzymes, like acroplasmin, directly into the vitreous. These enzymes are primarily approved for conditions like symptomatic vitreomacular adhesion, VMA, a disorder where the vitreous remains abnormally attached to the macula and pulls on it. While VMA may produce floaters, these enzymatic injections are not typically used for common, age-related floaters and are reserved for highly specific cases. Research into other enzymes is ongoing. Steroid eye drops. If floaters are caused by inflammation within the eye, e.g., uveitis, steroid eye drops or other anti-inflammatory medications may be prescribed to treat the underlying inflammation. This can reduce the release of inflammatory cells and debris, potentially preventing new floaters related to inflammation, but they do not dissolve existing, age-related floaters. Long-term use of steroids carries its own risks, such as increased eye pressure and cataracts. Atropine eye drops, or other dilating drops. These drops can slightly dilate the pupil, which for some individuals, might shift the floaters out of the central line of sight, making them less noticeable. This is not a treatment for the floaters themselves but rather a way to manage their visual impact by making them less bothersome. They can cause side effects like light sensitivity and blurred vision, especially in bright conditions. Supplements, an evolving area. The use of supplements, including vitamins, for treating eye floaters is an evolving area of research. While there's no universally accepted cure for floaters via supplements, some recent studies have shown promising results for specific micronutrient blends. These supplements are thought to work by reducing oxidative stress, helping to neutralize damaging molecules called free radicals that can damage the vitreous. Preventing glycation, inhibiting the process where sugar molecules attach to proteins, which can lead to vitreous clumping. Supporting vitreous health, aiming to maintain the clarity and structural integrity of the vitreous gel. Common ingredients in these targeted supplements often include L-lysine, vitamin C, grape seed extract, proanthocyanidins, zinc, and citrus fruit extract, hesperidin. It's important to understand that these studies generally report a reduction in symptoms or opacity, not complete elimination for all users, and more large-scale, independent research is needed. Always consult your eye doctor before taking any supplements, especially for specific conditions like floaters. They can confirm the cause of your floaters, rule out serious underlying issues, and advise if a supplement might be suitable, as quality and safety of supplements can vary significantly. Lifestyle and diet for overall eye health. While you can't entirely prevent age-related floaters, adopting a holistic approach to health through lifestyle choices and diet can significantly support overall eye health and potentially mitigate the progression or severity of vitreous changes, or reduce the risk of developing certain types of floaters, like those from bleeding. Dietary recommendations emphasize a Mediterranean-style diet, which is rich in fruits, vegetables, whole grains, lean proteins, especially fatty fish, high in omega-3s, nuts, seeds, and healthy fats, like olive oil. This type of diet naturally combats inflammation and oxidative stress, benefiting overall eye health. Prioritize foods rich in specific nutrients known to support eye health. Antioxidants, vitamin C and E, and beta-carotene, found in colorful fruits and vegetables like berries, citrus, leafy greens, carrots, and sweet potatoes. Zinc, found in nuts, beans, and lean meats. Omega-3 fatty acids, abundant in fatty fish, salmon, mackerel, sardines, flax seeds, and chia seeds. Lutein and zeaxanthin, primarily found in leafy green vegetables, spinach, kale, corn, and eggs. Conversely, try to limit or avoid foods that promote inflammation, oxidative stress, and vascular damage, which can negatively impact the entire body, including the eyes. These include highly processed foods, sugary drinks, and foods high in added sugar, unhealthy fats, trans fats, and excessive saturated fats, high-sodium foods, and refined carbohydrates. General lifestyle practices. Hydration. The vitreous is largely water. Staying well hydrated by drinking plenty of water throughout the day can support the health and clarity of the vitreous. Manage underlying health conditions. Effectively controlling conditions like diabetes, high blood pressure, and high cholesterol is crucial. These conditions can lead to eye complications, like damage to blood vessels or bleeding in the eye, that can manifest as floaters. Quit smoking and limit alcohol. Smoking significantly harms blood vessels and contributes to oxidative stress and inflammation throughout the body, including the eyes, potentially accelerating the aging of ocular tissues. Excessive alcohol can contribute to dehydration and systemic inflammation. Protect your eyes from UV radiation. Always wear sunglasses that block 99 to 100% of both UVA and UVB rays when outdoors to protect against oxidative damage to eye structures, including the lens and retina. Reduce eye strain and get adequate rest. While not a direct cause, prolonged digital screen use or close-up work can make existing floaters more noticeable. Follow the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds, to give your eyes a break. Additionally, ensure you get adequate sleep, 7 to 9 hours, as rest is vital for overall bodily function, including eye health. Manage stress. Chronic stress can lead to systemic inflammation and may increase the perception or awareness of floaters. Incorporating stress management techniques into your routine, such as mindfulness, meditation, or regular exercise, can benefit your overall well-being and potentially your eye health. Regular comprehensive eye exams are essential to monitor your eye health and detect any potential issues early. If you ever notice new or unusual floaters, or any changes in your vision, don't hesitate to reach out to your eye care provider. Early evaluation is the best way to protect your vision and ensure peace of mind. Key eye terms explained, glossary. For better understanding, here are some key terms used in this article. 20-20-20 rule, an eye care guideline recommending that for every 20 minutes spent looking at a screen, you should look at something 20 feet away for 20 seconds. Anti-VEGF, antivascular endothelial growth factor, injections, medications injected into the eye to block a protein that stimulates abnormal blood vessel growth and leakage, often used in conditions like diabetic retinopathy or retinal vein occlusion. Antioxidants, substances that protect your body's cells from damage caused by unstable molecules called free radicals. They are important for overall health, including eye health. Cataract, a clouding of the natural lens of the eye, leading to blurry vision. It's a common side effect after vitrectomy surgery. Cryopexy, freezing, a treatment that uses a freezing probe to create a scar that helps seal the retina to the eye wall, often used for retinal tears. Diabetic retinopathy, eye damage that can occur in people with diabetes, caused by damage to the blood vessels in the retina. It can lead to vision loss and may cause bleeding in the eye, which appears as floaters. Enzymatic vitriolysis, pharmacologic vitriolysis, a medical treatment involving injecting specific enzymes into the eye to break down specific structures within the vitreous, sometimes used for certain conditions related to floaters. Glaucoma, a group of eye diseases that damage the optic nerve, often due to high pressure inside the eye, which can lead to vision loss and blindness if untreated. Glycation, a natural process where sugar molecules bind to proteins, which can lead to tissue stiffening and damage over time. In the eye, it can contribute to the clumping of vitreous fibers. Inflammation, uveitis, swelling or irritation of the eye's middle layer, uvea. It can cause floaters due to inflammatory cells released into the vitreous. Intraocular pressure, IOP, the pressure inside your eye. High IOP is a main risk factor for glaucoma. Laser photocoagulation, a treatment that uses a laser to create controlled burns around a retinal tear or to seal leaking blood vessels, forming a scar that helps secure the retina or stop bleeding. Laser vitriolysis, a procedure that uses a specialized laser to break apart or vaporize large, disruptive eye floaters. Macular pucker, or epiretinal membrane, a layer of scar tissue that forms on the surface of the macula, the central part of the retina responsible for sharp, detailed vision. It can distort vision. Myopia, nearsightedness, a common vision condition where close-up objects appear clear, but distant objects appear blurry. Nearsighted individuals are more prone to floaters. Neovascular glaucoma, a severe and rare type of glaucoma characterized by the growth of new, abnormal blood vessels over the drainage angle of the eye, often causing a sharp increase in eye pressure. Optic nerve, the nerve that connects the eye to the brain, carrying visual information. Damage to this nerve is the primary cause of vision loss in glaucoma. Oxidative stress, an imbalance between free radicals, unstable molecules that can damage cells, and antioxidants in your body. It contributes to aging and various diseases. Pneumatic retinopexy, a procedure for certain retinal detachments involving the injection of a gas bubble into the eye to help flatten the retina, often combined with laser or cryopexy. Posterior vitreous detachment, PVD, a common age-related condition where the vitreous gel pulls away from the back of the retina. This often causes a sudden increase in floaters and sometimes flashes of light. Retina, the light-sensitive layer of tissue at the back of the eye. It converts light into electrical signals that are sent to the brain. Retinal detachment, a serious eye condition where the retina pulls away from its normal position at the back of the eye. This is a medical emergency that can lead to permanent vision loss if not treated promptly. Retinal vein occlusion, a blockage of one of the small veins that drain blood from the retina, which can lead to bleeding or fluid leakage. Scleral buccal surgery, a surgical procedure where a silicone band is placed around the outside of the eye to gently push the wall of the eye inward, supporting the retina in cases of detachment. Vitreous hemorrhage, bleeding into the vitreous humor of the eye, which can cause new floaters. Vitreous humor, the clear, jelly-like substance that fills the space between the lens and the retina in the eye. It helps maintain the eye's shape. Vitreomacular adhesion, VMA, a condition where the vitreous gel remains abnormally attached to the macula, central retina, and pulls on it, which can cause vision distortion and floaters. Vitrectomy, a surgical procedure to remove the vitreous humor from the eye, often performed to remove severe floaters or treat other retinal conditions.